Hi there, I'm Holly. I'm here to discuss with you my topic of discussion, which is communication for consent. I chose this topic mainly because I work in interventional radiology where we consent patients for because we're going to sedate them or because of the procedure that we're going to do for them has some risks and some benefits to it, and the patient has the right to know what they are and have the choice to decline them. So in my topic, I'll go over what is consent, what should be included in consent, why it is important, complications like understanding medical information and language barriers, exceptions to consent like power of attorneys in emergency situations. Now, what is consent? Consent is a written legal agreement. It's between the patient and the physician pertaining to specific and significant procedures or treatments that they're about to have. The patient is agreeing to the terms and the services, the risks and the benefits of the procedure, and this form contains all of its details. So this is just like their agreement between the patient, the physician, saying that they're agreeing that they're going to have this done, so that when they're under the treatment, if anything comes up that they feel wasn't covered, they can look back at this and say that yes, it was, and go from there. What should be included on consent is the patient's diagnosis, the purpose of the treatment or procedure, risks and the benefits, alternatives along with their risks and benefits of not receiving the treatment or undergoing the procedure. So this includes everything, so that if they decide that they're not going to do this, well, the doctor has to discuss with them that, okay, if you don't do this, X, Y, and Z are possible. Here's why I feel that this is the best beneficial to you right now. Just giving the patient the opportunity to decide how they want to do or what they want to do with their care. Why is consent so important? It's to make sure that the patient understands what is entailed into the procedure. It also is to protect the physician. In the event that the patient states that they did not perform to expectations, they have the proof that they covered it, they went over all the details, what could happen, why it's so important that we do this, and they have this form for backup. It's also to protect the patient. The patient, in the event that the physician went out of boundaries on what was covered, they have proof. They have proof that they did not cover this in the details. And so when accidents happen or physician see something else and decides that they're going to go forth and take care of it, you still have a right to know for most cases. And I'll get into the details of that later on in some of the odd scenarios or situations. Complications, understanding medical terms, and language barriers. Now, being in the medical field, we understand a lot. There's a lot of words that a lot of people don't understand, but to us it seems like it's second nature. And, when you talk about it, it's like, you know it, but they don't get it. So nearly half of the people signing consent do not understand what is being explained to them, but sign anyways. And that's not okay. It should really be taking an effect that, that they don't understand this language and maybe breaking it down for them a little bit more. Physicians and staff, they try their best to, which is understandable, but, this is partially the patient needs to speak up when they don't understand and maybe let them know to break it down a little bit further. And then language barriers. Some patients say that they speak some English and try to get away with, the little English that they know. But if half of the English speaking patients have a hard time understanding medical terms, so will those who don't speak English. So it's very important to use a translator or someone in the area that speaks their same language to kind of make sure that they understand everything that's going on, not just the small stuff. Because this is a legal document. It's also to protect everyone. And patient safety is so important in the medical field. The exceptions, power of attorney, people like children who are under the age of 18, patients who are unable to sign for themselves, and then emergency patients that come in critical conditions. So even though a child is under the age of 18, it does not refrain them from being part of the consent consenting process. They should be well aware of what's going on, and even though it's primarily up to the patient's parent, they do have a say in, and the doctor will discuss that with them and make them feel more comfortable going forward with the procedure or treatment. Medical conditions, people who are born with certain defects, or people who have been in an emergency and are not able to take care of themselves anymore. That then goes on to a family friend, someone important in their lives to handle their care, like a power of attorney. It also is known as a proxy agent or surrogate. If the patient is unable to designate, they may be chosen by the court of law in that case. But this is just so that the patient still has some sort of yes or no say in on their care, whether they're with it or not. A lot of times the patient will put together a will and say what they want done with their care going forth, in the way that if they cannot, there's something to back it up. In the state of an emergency, critical conditions, a patient who comes into the ER and something bad's really happened, sometimes they cannot speak for themselves, but this is now up to the doctor's determination to life-threatening conditions. If the doctor doesn't do anything and waits, is the patient going to die? So it's kind of the life or death situation, deciding if the patient should be intervened right now. Another deciding factor is if the patient's under the influence or impaired judgments due to alcohol or substance abuse. Is their judgment the best for what is needed for the care? And it kind of gives the doctors a little bit more leniency into what they want to do for going forth. I was reading a lot of cases where a patient came into the ER intoxicated, was refusing all the exams, but he was in a car accident. There was blood everywhere. The medical staff wasn't concerned of internal bleeding, so they went forth and treated him, tried to take him to court for it. But in the scenario, the doctor was doing what was best for the patient, and there was life-threatening situations that were going on for the patient. So it was a very interesting read. Complications in a procedure, another situation where the patient's already out or in a procedure, and they're finding life-threatening things during. There was a case where a woman was getting an ectopic pregnancy removed, and inside, when he was in, the doctor found that she actually had appendicitis, and it was very severe, and if he didn't treat it then she would have had further down the road other complications, and you don't want to reopen someone up after they're already opened up right away. So it's for the patient's safety, and the patient tried to sue the doctor, saying that he went outside the boundaries, but he won due to the fact that it was a life or death kind of risk, especially since she was pregnant too. So it just involved her and her future baby. So in those situations, the doctor has determination on what to do, but it doesn't happen that often. There's usually some way of contacting a patient's family member. It's just in those very severe moments that has to happen. So in conclusion, I always think that it's best to be as active as a patient when consenting. It's important for the staff to use wording that's understandable. Prepare for accidents. Keep a file of emergency contacts that you trust with your care going forth. I think it's important for everyone to have that, whether you're young or old or anything. It's just nice to have some sort of backup. Physicians want to do what is best for the patient. It's true. They're not trying to get more money from you or anything.